Hi, I'm Phil Siegel of Prostate Cancer Support Canada, one of the organizations belonging to the Active Surveillance Coalition. Welcome to our new series called Active Surveillance 101, AS 101. We are presenting a series of videos to provide information for men and their partners. We assume these men have rising PSA with suspicion of prostate cancer. Our actors are real physician experts and real patients and their partners. Our program today is called The Rising PSA and features Nancy and Larry White and family physician Dr. Stephen Spann, Dean of the University of Houston College of Medicine.
Hi, Larry, and hello, Nancy. Nancy, I didn't expect to see you today. How are you doing?
Well, we're doing pretty well, I think. Nancy and I've been seeing you for quite some time, but she's not come to any of my visits with you. And when your office called about setting up this consultation concerning a recent PSA, I became pretty anxious, and I could only think that I had a rise in my PSA. And as you know, my dad died of prostate cancer. So as I began to think about all the possible things that could happen, I became quite stressed. And I asked Nancy if she'd join me today, because typically when I go to the doctor's office and I get home, she asks me questions. I never know the answers to them, or half the time I don't. And she asks questions that I should have asked in the first place. So I thought I'd bring her along today. So we devised some questions for you so we wouldn't forget. And I'd also ask if we might record this session. So when we returned home, we would have your information and we could talk about things.
Well, it's great to see you guys again. Nancy, I'm really glad you're here. I think it's really helpful to have couples involved in discussing and making decisions about these kinds of issues. I'm delighted for you to record our conversation today. And Larry, your suspicion is correct. Your PSA is still elevated at 5, as it was when we checked it a couple of months ago. Remember that we wanted to recheck it to see if it remained elevated. So you've now had 2 consecutive PSAs of 5, and that's up from a level of 3 1 year ago. So that is a significant change, and we need to talk about that.
Dr. Spann, could you tell me what is PSA? What do the letters stand for? And also, what is a normal PSA?
Sure, absolutely. So the acronym PSA stands for prostate-specific antigen. And the PSA is secreted by the prostate gland in all men. We do use it as a biomarker for possible prostate cancer. We use it as a screening test for prostate cancer, and we also use it in active surveillance of individuals who have low risk, very low risk prostate cancer, and we even use it to follow people who have been treated for prostate cancer with radiation therapy or surgery. It is important to pay attention to changing PSA levels, and as we can see, Larry's has increased over the past year. Now, a normal level is typically considered to be less than 4, although some physicians use an age breakdown in terms of normal, but most physicians would say, well, if it's less than 4, it's okay, but once it reaches 4 above, that's elevated, and we need to pay attention to that.
Well, Dr. Spann, how accurate is the PSA test?
Yeah, great question. Go ahead.
Well, just wondering, I mean, we did have 2 in a row, but, I really don't know if it's accurate enough for me to jump to conclusions or not, or what.
You know, there is no perfect test in medicine. There's variability from test to test sometimes, just natural physiologic changes in biomarkers. And so one day they may be normal, another day elevated. And tests always have a potential of having a false positive, meaning that they're abnormal when no disease exists, or a false negative, meaning that they could be normal in the presence of disease. So there is no perfect test. And that's one of the reasons that we repeat an elevated test within several weeks, just to be sure that it remains the same. Having an elevated PSA does not necessarily mean that you have prostate cancer. But when you have 2 elevated tests in a row, we start to pay attention. Does that make sense?
I think so. So we're not going to jump to conclusions yet.
Right. I don't think we can jump to any conclusions at this point.
Because Nancy and I were wondering, does that high PSA mean that I do have cancer? So I think you're kind of helping us with that.
It does not necessarily mean that you have cancer. The only way to find out really is to do a biopsy. That is the gold standard, as we say. But increasing elevation of the PSA does make us concerned that cancer could be a possibility.
Well, are there certain things that Larry should do or not do before a PSA test to be sure that it's accurate?
We have to consider other things that can cause elevation of the PSA. One of those is infection. You don't have any symptoms of infection. One of those is just a large prostate. We call that benign prostatic hypertrophy. All of us as guys, as we get older, our prostates get bigger. They grow out as well as in. And a large prostate can secrete more PSA. And so one of the ways we look at that is something called PSA density, where we actually do an ultrasound of the prostate to see what size it is. And then we look at the ratio between the PSA level and the density of the prostate to see what the prostate density is. If you have a large prostate, that could account for some elevation in the PSA.
Well, one of the things that I've neglected to tell you about is that I have had more difficulty urinating, more difficulty to start urine flow, and then my stream is small, and then sometimes I'll dribble when I go to stop. So, I was kind of concerned that maybe that was about cancer, but I think you're saying that it could be, what was it, benign prostatic hypertrophy?
Benign prostatic hypertrophy. Exactly. So, again, as the prostate grows, as we mature, I like to say mature and not get older, it grows out and in, and it compresses the urethra. The urethra is the tube that carries the urine to the outside, and so as that gets compressed, there's some obstruction, and so you're urinating against an obstruction, so to speak. So what that means is that your stream is less strong. Sometimes it means you even dribble. It also means you don't completely empty your bladder, so you probably urinate more frequently than usual, may even get up at night once or twice. Now, that's pretty common as we mature. It can be a symptom of prostate cancer, but not necessarily, because many guys who have large prostates, benign prostatic hypertrophy, have these symptoms of obstruction.
Well, I guess a concern of mine is, another concern actually, is that, we have 2 sons and a daughter, and, my dad had cancer. I think I've been thinking I'd probably have it. I don't know. My level of anxiety is really kind of going up, but should I have genetic testing of some sort to see if there's any issues that might cause my children to have problems, or even my sons? When should they have their first PSA? How do we proceed in that area?
Well, Larry, let me first say that I think your anxiety, your concern is a normal human reaction. I don't want you to get overly concerned, but I want you to be concerned enough that we do all the right things to check this out, right? And it is true that when an individual has a first degree relative, meaning a father or a brother who has had prostate cancer, that person's risk of prostate cancer is higher than average. So that is true. There are some genetic markers that we can do to look for increased prostate cancer risk. And we could do those markers on you. That wouldn't necessarily change our thinking about whether or not to do a biopsy, though. There are some markers such as BRCA1 and BRCA2 that could be important to do, because that could indicate a risk in your daughter for other types of cancer, ovarian cancer, breast cancer, and so forth. So that's something we might want to consider doing. Yes, you have some increased risk. Yes, we could do biomarkers, genetic markers. Having said that, we really ought to think about having a biopsy done.
Well, again, my anxiety, I think, is kind of escalating maybe more than it should, but where do you suggest we go from here?
Well, I think we need to refer you to a urologist that is up to date on the modern testing and treatment of prostate cancer. The good news is that a lot of patients who are diagnosed with prostate cancer have very early stage cancer, very low risk of that cancer advancing to something more serious. And many of these patients choose for something we call active surveillance, meaning that you really don't have to proceed to treatment, that because the tumor may well grow very slowly, that it can be watched over time with repeat PSAs, with repeat MRIs, occasional repeat biopsies. So I think we need to send you to a urologist who will carefully evaluate you. That will include likely an MRI-guided biopsy, and then based on the results of that biopsy, talk to you about treatment choices. One of those would likely be, in the case of a low risk or very low risk tumor, active surveillance.
Active surveillance sounds like a reasonably good possibility for me. I've even been hearing that prostate cancer has been overdiagnosed and perhaps overtreated. And so, we certainly trust you. I don't think I want to be overtreated or undertreated. Perhaps the active surveillance group, something like that, might be reasonable for me. So I guess the next thing we do is be referred to urologists.
I think that would be the next step. It turns out that there is some controversy even around screening for prostate cancer. The U.S. Preventive Services Task Force recommends that men receive all the information about the benefits versus the potential harms of being screened and make a personalized decision. It's a very personal decision. The good news is that most men who are diagnosed with prostate cancer die with it and not from it, because most of these tumors are very slow growing and do not end up causing major problems. The issue of overdiagnosis and overtreatment has to do with the fact that some experts now believe that, in fact, we have been over-concerned about those early cancers and overtreated them, and that for many men, a better option, a better choice would be active surveillance. We can refer you to a urologist who will go over all of this information with you, do the right tests, and you and Nancy can decide together what would be the best treatment plan for you.
Okay, well, we really appreciate all the information that you've given us today. And I think we do need to go home and talk about this. But I will say, after my dad died of prostate cancer, I've just been leaning on once it came up for me, I was just going to get the dadgum thing whacked out of there and move on. But I think after our discussion today and kind of information that we're getting, that might not have been a reasonable approach. And I think I need to continue further on and find out the different options and kind of go on from there. And active surveillance is something that I've not thought that much about, so I think that's a reasonable thing to think about. But I will tell you, I don't want to die of cancer. So I guess we'll try that and try to figure it out. And we may be, trying to talk to you again once we see the urologist, even to run things by you, because you're someone that we definitely trust.
Well, I am confident that once you've had the right tests, the biopsy, you will be presented with all of the treatment options, and you may well decide that active surveillance is the best option for you. And I want you to know that I'm going to support whatever decision you make. I also want you to know that I am here to answer any questions, to discuss more if we need to, that I am confident that you will make the right decision for you, and that will be okay.
Well, and of course, it's going to be the decision for me, but for Nancy and for the family as well. So clearly, this is a family discussion for us. And again, we really appreciate your help.
Thank you.
Well, I totally support that, and just glad to be of help.
Okay.
We really appreciate it. Thank you.
I'd like to thank Larry and Nancy and Dr. Span for their excellent presentations today. This presentation was recorded, and the videos will be available on the ANCAN, ASPE, PCRI, and Prostate Cancer Canada's website. Also, please stay tuned for further episodes of Active Surveillance 101.